What we wanted to do is kind of come back and touch a little bit on vitamin C. You may be aware that Dr. McCullough invited me on his show a couple weeks ago to talk about vitamin C as it specifically deals with cancer. And so what we did together on the show was, well, first of all, hats off to him for what he's done there, asking questions and really trying to push the envelope as it relates to integrative and functional medicine. And so we were discussing the science that relates to vitamin C, because most people look at vitamin C as something is just related to citrus. But really what we're looking at is we're looking at an evidence-based therapy that just happens to come from the natural or quote-unquote alternative world. And it's just the science, being in the science, that I think actually pushes us towards a more integrative and holistic approach. And so that's what we discussed on the Dr. McCullough podcast. But we thought this gave us an opportunity to kind of regroup a little bit on vitamin C, go through some of the evidence behind it as it relates to the treatment of cancer, and then also talk about what's called stacking. And we'll get to that in just a moment. So here at Brio-Medical, we are a holistic integrative cancer healing center here in the beautiful state of Arizona and in the beautiful town of Scottsdale. And that top photo right there is what it always looks like here. It's beautiful. Actually, it can be a little hot at times, but this year we've had a lot of monsoon, so it's been very, very nice and a little bit more humid. Actually, in that photo down below, you see one of our naturopaths, Dr. Labont, and some of our current and past patients. We seek to restore and heal the body. The word integrative actually means to restore anew, and that's what we seek to do. The word physician in Hebrew means healer. The word doctor in Latin means teacher. So we take those three words and that really guides us as to what we do. We look to teach the body how to heal and renew itself. And the body's designed to do just that. I'm the medical director here at Brio-Medical. I'm both a medical doctor and a homeopathic medical doctor. We have 4 awesome physicians here, 3 of which are beyond me. One is Dr. Kim. I'm the medical director. Dr. Kim is a medical doctor. And then we have 2 naturopathic doctors, both Dr. Labont and Dr. Spat. So when you look at what holistic treatment actually means, a lot of people will look at that phrase and think natural. And that is definitely true. But holistic really is a overall perception. It's a paradigm shift of recognizing the whole, not just focusing on the parts. Conventional medicine, of which I was trained, is a very segmental, compartmentalized approach to the teaching and the practice of medicine. But what can happen when you become very compartmentalized is you can lose sight on those things outside of that specific compartment. And the holistic perspective is recognizing that the individual parts are only there to benefit the whole. So if we target individual parts and yet destroy the whole, what do we have? We don't have something that is sustainable. So what we do here at Brio-Medical is we use this holistic perspective to recognize that we have 2 goals here. One, heal the body. That's a primary goal. Heal the body. Number 2, heal the body from cancer. So what we want to do is bring those dual goals together, and you can see some list of therapies there that we will use in conjunction, in sequence, in stacking to really promote those 2 objectives. And you can see here on the second slide, we just add more things to this option. Hyperthermia, ozone therapy, PIMF. We have a nutritionist on staff. We have a fantastic team here. And we also try to get at the root cause of why cancer has developed. Cancer is really something that's born out of an adaptation to an inhospitable environment. And what we want to do is we want to understand as much as we can why this cancer developed. In the short term, the change of what a cancer cell will do is actually just an attempt to survive. But in the long term, this survival mode becomes something that becomes detrimental to the body as a whole. There's that holistic approach again. And that is what we call cancer. And so in the short term, it actually can be a benefit. It can be an adaptation to heavy metals, to mycotoxins, to environmental toxins, to whatever ailment that you can think of or exposure that you can think of, stress. And all of this then forces cells to adapt, and then long term, this adaptation becomes something that's detrimental. So what we want to do is dive into the root causes, but then institute strategies and integration and sequence of therapies that allow us to heal. I think it's very important to understand history. We are born out of history. Martin Luther King said we're made by history. I think it's a little bit different. We have to recognize history for what it is. It's where we came from. We have to learn from our history so that we can make new history, a future, but new history. We don't want to simply repeat history. History's full of that. What we want to do is we want to learn from past mistakes, move forward, and actually make history. So learn from history. And that's what I really try to do as I look through history, look at words, what's called etymology, help us to better understand where we've come from to help guide us where we're going. So in vitamin C, I think a lot of people will look at the use of vitamin C in cancer and think, well, this is a relatively new phenomenon. It's a relatively new discovery. But in actuality, this has been around a long time. In fact, one of the first documented published studies or published articles as it relates to vitamin C was in the use of polio in 1931. So this has been around for about 100 years. William J. McCormick is actually considered one of the first published articles, studies as it relates to vitamin C and metastasis, and he published that in 1954. Again, we're talking a long time ago. This is not new. Ewan Cameron was the lesser known combination of the dual that involved Linus Pauling, and Linus Pauling won the 2 Nobel Prizes of Medicine and Physiology back in the 70s. But Ewan Cameron actually started working in vitamin C, published a book, an article before even meeting up with Dr. Linus Pauling, and he was a Scottish surgeon, and he was really pushing the envelope of vitamin C before he teamed up with Linus Pauling. And you can see there on the right, actually with Ewan Cameron and Alan Campbell, looked at oral vitamin C, what would be called orthomolecular vitamin C, in the treatment of cancer. Dr. Frederick Klenner used high-dose vitamin C all the way up to 300 grams IV. We'll touch a little bit on that in just a little bit. And used it in a wide variety of therapies, of which advanced cancer was one of them. He, of course, looked at autoimmune disease, encephalitis, pneumonia, all variety of viral illnesses, shingles, herpes, polio, etc. Now, Ewan Cameron teamed up to Linus Pauling in the 1970s, particularly the first one in 1976, where Cameron and Pauling actually started treating patients with terminal cancer with 10 grams IV vitamin C. Now that sounds like a lot looking at the oral supplementation, but the 10 grams IV for 10 days, and then they switched over to 10 grams orally, was actually quite a small dose. But at the time, that was quite the feat. What they found in this initial 1976 study was that there was a 4.2% prolongation in survival. So prolongation means their life was extended. And that's significant with just 10 days of 10 grams of IV vitamin C switching then to oral. So they then sought to repeat that in terminal cancer patients in 1978. And again, same strategy, 10 grams IV for 10 days followed by 10 grams orally. And here they found a 5,400% increase in 1 year survival by simply adding vitamin C. No other therapies. These were terminal cancer patients. So this was a profound finding in 1976 and 1978. Abram Hoffer came in and also used 10 grams orally vitamin C, finding benefit in cancer. This then moved international, much more than just Europe, over to Asia with Murata, Moshigi, and Yamaguchi, looking at prolongation of survival with IV vitamin C up to 29 grams here. So really pushing beyond that 10 gram envelope to almost 30 grams. But then there was a shift in 1978, shortly after Pauling. A group of physicians out of Rochester, Mayo, Mortel, Cregan, and Fleming, they sought to repeat the Pauling-Cameron study, but they made one fatal error. Instead of giving 10 grams of IV vitamin C for 10 days, they just started off with 10 grams orally, and that's all they did. And they found no benefit. Now, this actually was then repeated in 1985. Then a great debate broke out between you and Cameron and one of the lead authors of the Rochester Mayo studies. And because the narrative today has been for many, many, many decades that vitamin C doesn't have an anti-cancer benefit, you know who won. Rochester Mayo won. But what they didn't recognize the process of what's called pharmacokinetics. See, at the time of those Rochester Mayo studies, and even Linus Pauling's, there was the recognition that with vancomycin, a very powerful antibiotic, there was a difference in pharmacokinetics of oral versus IV delivery, meaning each route is going to provide different distribution, elimination, and travel throughout the body. The oral route of IV vitamin C will never reach a therapeutic plasma ascorbic acid level that can be pro-oxidative against cancer. It will not. Even the liposomal will not. IV is the only route. And I would tell you that the Cameron Pauling 10 grams of IV vitamin C is probably insufficient as well. But even with that, they had a profound effect. So what we see is that a narrative was set for 50 plus years now that was based on inaccurate information. Even Cameron and Pauling had a misunderstanding there, but definitely the Rochester Mayo authors had a clear misunderstanding, yet they set a narrative that has lasted now for 50 years, but that's changing. And it started to change with the great work by people like Dr. Riordan. A lot of people that look at vitamin C, they recognize Riordan and the Riordan Clinic and the great additions they've made to the integrative and alternative movement, especially as sustaining and reinvigorating IV vitamin C in the treatment of terminal cancer. Here he was using 50 to 75 grams, so he was really pushing the envelope beyond what even Pauling and Cameron were doing. And they were actually understanding the pharmacokinetics, how the process of it's introduced into the body, distributed, how it works, and how it's eliminated. So really taking the bench pharmacological application of what we do in conventional medicine and applying that to a natural therapy. Dr. Robert Cathcart continued this on in advanced cancer with up to 300 grams repeatedly. He also used oral. Then the great Dr. Richard Davis also using 300 grams. We did lose him to colorectal cancer 5 years ago, but he was a great entrepreneur, worked with NASA, worked with Blue Angels, just a great addition to the medical community at the time. And he added so much, and he's left behind a lot that we'll carry forward. And then even modern time here, Jeannie Driscoll, who is works in Kansas City and does a lot of great publications, a lot of great work, even was a lead editor on an article talking about the historical bias of vitamin C, just published this year. Paul Merrick, who I'll have the pleasure of speaking with at a conference down in Clearwater, Florida, September 9th and 10th, one of the world leading experts on sepsis. And he actually used low-dose vitamin C IV in sepsis. Thomas Levy has been one of the world experts on vitamin C, book Curing the Incurables, where he talks about some of that. So there have been a lot of physicians and researchers throughout the decades that have really laid the groundwork, and hats off to them because they have really pushed hard and really broken down the barriers that have allowed us to achieve a place where we are now, where I believe that vitamin C in a high-dose pro-oxidative way is really going to be the flagship that really blends conventional and integrative medicine together, but in a way that heals the body. So when you look at vitamin C, with the real vitamin C, please stand up. Because when we think about vitamin C, we'll think about ascorbic acid, and that is true. They are the same, but there's many different forms of vitamin C. Here I'm talking about sodium ascorbate versus ascorbic acid, but there's magnesium ascorbate, there's calcium ascorbate, there is dehydroascorbate, there's many different forms. The question is, what's the best form to deliver to allow us to yield the results that we're after, which is eliminate the tumor and heal the body. Sodium ascorbate is the best form. It's a more pH neutral form of vitamin C. And when given IV, we don't have to worry about the acidity. Even with ascorbic acid, which has a very low pH, and you try to buffer it to bring it to pH neutrality, it's not achievable. So sodium ascorbate is really important in achieving these high doses that are required in the treatment of cancer. I love this slide. Now, this is a slide from one of my lectures that I gave in Denver in June, and I'll also be giving in Clearwater in September. So many people look at vitamin C and they say, well, it's just a vitamin. I mean, it's not a drug. It's not a surgery. Anybody can get it. But understanding where the word vitamin comes from, I think helps us to really understand how that word is not a detriment. It's a big value. Originally, this was coined by a Polish biochemist by the name of Casimir Funk. And this was in the 19th century, and the thought that there were these substances, these molecules called amines, and that these amines were necessary and a requirement to sustain life. So as a result, these amines were critical to life, and the Latin word for life was vita. Thus we had amines that were vital for life, vitamine, as it is commonly used today. But vitamin C, though its name is vitamin, it is a vitamin, it is essential and critical to life. But really what's important about vitamin C is that its biological functions and its biological properties of electron donor that are what are important and imperative here in the treatment of cancer. And understand when we look at vitamin C, we as humans do not make vitamin C. We are deficient in an enzyme called gluconolactone oxidase. So vitamin C in our diet is essential to our survival. Without vitamin C, there's something called scurvy, severe vitamin deficiency that leads to death. It was the #1 cause of death in naval ships back in the 17th and 18th century. But because we lack that enzyme, we need vitamin C in our diet. It's essential, and that enzyme is critical to life. So you really could say that vitamin C is an electron donor that is critical to life. So in a way, it is a vitamin. But what is vitamin C from a more modern perspective? There's vitamin C, there's the reduced form of vitamin C, which is ascorbic acid. There's the oxidized, meaning it's donated electron, dehydroascorbate. It is an electron donor, as the previous slide showed. There's a lot of published literature, research in conventional journals and in medical journals that are actually now referring to vitamin C as a drug today. Now, it's not a drug, but my concern is they seek to regulate it as a drug. But its effects are more metabolic, and we'll touch on those in a second. 2005, Dr. Chen actually referred to vitamin C as a prodrug in the delivery of the drug, hydrogen peroxide. And then many other journals have referred to vitamin C or ascorbic acid as pharmaceutical ascorbic acid. So what is it? Yeah, it's really all of these. But if you had to get down to, what is its basic function, it does deliver hydrogen peroxide as it relates to cancer into the tumor microenvironment and the tumor itself. It is an electron donor. And it's these critical functions that really metabolically shift what cancer is doing and turn it on itself. And we'll touch a little bit on that in just a second. Again, the research on this is growing exponentially in our understanding of what's happening with vitamin C. It is by no means a drug. It doesn't matter how we call it a drug. When you look back through history, whether it be the 14th century, the 16th century, or even into the 20th century, a drug was either defined as something that was used in preparation of medicines, something that was a poison, or something that was an opiate or narcotic more recently. Vitamin C is none of those, so it's definitely not a drug. The future of medicine can be found in the field of study of omics, meaning genomics, epigenomics, transcriptomics, proteomics, metabolomics, and immunomodulomics. What this is collectively is the study of all the components, all the pieces, all the molecules that are involved in the structure, the function, the dynamics of a cell, tissue, or organism. And this, it can be in normal healthy cells, but this can also be in abnormal unhealthy cells like in cancer. So in genomics, it's looking at the collection of the genes, the genome. The epigenomics is the collection of all the expression of the genome, what's called epigenome or epigenomics. That's above genome. Transcriptomics is when you have the genes that are encoded into RNA. The collection of the different RNA types is transcriptomics. Proteomics is the set and function of all the proteins in the body. Metabolomics is one of the more exciting, is actually looking at the body as really just, it's a series of metabolism. It's the pathways, it's how things flow through the body. So if somebody looks at, say, like a hormone and says, oh, I have low testosterone, simply adding in testosterone there doesn't imply or predict that the body's going to do the right things with it. The body is a complex series of metabolic pathways that we have to recognize from a holistic perspective, so that if something's low and we add it in thinking the body's going to do normal things with it, it may be low because the body is doing abnormal things with it to begin with. And then the last is really just a word I even made up myself, immunomodulomics, which is simply just the modulation of the immune system. When you look at cancer, it's really interesting. A lot of the immune system effects you see in cancer are quasi-similar to an autoimmune process. But here in cancer, the immune system is turned on the immune system. But what we need to do is modulate the immune system to turn the immune system back on to the cancer. Not destroy it, but actually turn the immune system on the cancer. So just some broad perspective review on the mechanisms of action of vitamin C as it relates to cancer as described in the literature. It changes epigenetic expression. It's directly cytotoxic, which is destructive to cancer cells. It's anti-proliferative, meaning blocking that growth. And again, this is not just broad, these are broad words, but in anti-proliferative, we know that it can inhibit what's called AKT, P13K, mTOR pathway. This is a very specific pro-growth pathway that everybody that builds muscle through exercise with weights recognizes. You break down muscles to build them back bigger and stronger. And cancer takes advantage of this to allow itself to grow and get an advantage in proliferation. And vitamin C can come in there and inhibit that. It's anti-inflammatory, it's anti-lymphogenic, anti-angiogenic, this abnormal blood vessel supply growth that is so critical to the nutrient and supply of a growing, very rapidly growing tumor, but also the elimination of waste. But this creates a challenge, the angiogenic process. Pro-apoptotic, stimulating the programmed cell death of cancer. There's that word, immunomodulatory. Vitamin C is very much stimulating in the immune system, whether that be dendritic cells, whether that be natural killer cells, whether that be cytotoxic T lymphocytes, or reducing Treg cell activity. The specific functions of vitamin C here, high dose in the tumor microenvironment, is becoming, I don't want to say standard known, it's becoming more well known and repeatedly published. It's antiviral. And down in Clearwater Beach, Florida, I'll be talking about a lot of its antiviral effects, as well as cancer and surgery effects, etc. It's mitochondrial, but what's interesting here is actually it can maintain mitochondria in the immune system, but help to depolarize it and destroy it in cancer cells. It's anti-cancer stem cells. These are the backups that we want no part of. It's anti-metastatic, and this is important, especially when you look at something like surgery, which can cause local reseeding, local recurrence, and metastasis through the process of merely cutting this out. Vitamin C, pre and post-op, can really work to prevent the inflammatory burst that's associated with surgery that really can help favor this metastatic process or local recurrence process. It counters DNA damage, it repairs it, it works in redox potential, so reduction and oxidation. I've talked about the electron donor, that's really what redox is. It has metabolic effects, it attacks hypoxia. Vitamin C promotes collagen growth, that's why it's so important in the healing from surgery. In fact, the original research with Dr. McCormick and Ewan Cameron was talking about vitamin C's effect in collagen and thinking that that was playing a role in metastasis. So all the way back then, when they had such little information to work on, They really knew more than what we have now, where we have so much information, yet we do so little with it. It works within the extracellular matrix, within the tumor microenvironment, to really change this environment where the tumor cells interact with the body as a whole. No longer can we look at cancer as a solid ball of cells, but it is in part a solid mass of cells that interacts through a gray area with the body and the immune system. It's called the tumor microenvironment. And that's really that's the front line. That's the battle zone. It's a cofactor in many different things. It augments chemotherapy. That's right. A lot of research is showing how vitamin C augments chemotherapy. It can restore chemosensitivity where chemotherapy resistance exists, and it reduces side effects. Radiation. There's research now showing that IV vitamin C given within 1 hour of radiation increases the oxidative effect of the radiation. It doesn't counter it because it has to be a high dose pro-oxidative effect. It's long been felt that vitamin C is an antioxidant. It is, when it's oral. The oral route will never achieve the plasma levels of vitamin C that achieve a pro-oxidative effect that can kill cancer cells. Never. It can't do it. Again, even liposomal. But when you give oral vitamin C, it elicits an antioxidative effect. And that is what the concern is about radiation and chemotherapy, is how that could actually counter it. But in actuality, when given high dose in IV, vitamin C augments radiation. But here's the great thing. It doesn't do that to the healthy cells. There's this new understanding how healthy cells can handle this high dosing. It doesn't damage it. You see it in vitamin C. You see it in vitamin C's effect with radiation in healthy cells. You see it with hyperthermia. But yet at the same time, in the same individual, cancer cells, tumor microenvironments, solid tumors, they're going to be destroyed. So two environments within the same individual, yet a delivery of high-dose vitamin C will actually have different effects. Vitamin C interacts and affects hormones and is involved in hormone therapies, whether that be aromatase inhibitors or other hormone therapies used in breast cancer and prostate cancer. It augments things like tamoxifen if you're with your conventional oncologist. It augments Herceptin. These are well-known conventional medical therapies working in ER/PR positive breast cancer. And a conventional medical term which really was started by quote-unquote alternative medicine is immunotherapy. So these would be things like checkpoint inhibitors. These are all the drug ads you see on TV with upcoming football season. Every commercial is going to be somebody running on a beach chasing butterflies, and they're going to talk about how your arm's going to fall off. But you take this drug and it may help you in cancer. And they're talking about working within the immune system, but more in a modern day conventional approach. So really it's kind of modern day chemos, but these can be very valuable, and vitamin C augments these immunotherapeutics. You know them as the MABs or the MIBs. So any word that has a MAB at the end or IB at the end, that's what we're talking about, targeted immunotherapy. But we can also work in a natural perspective that actually augments the immune system and not use more of a chemotherapeutic approach. And vitamin C is one of the things that allows us to do that. So is there, when looking at the different types of vitamin C, so for example, vitamin C or ascorbic acid donating 2 electrons to get to the compound dihydroascorbate, very small change, just 2 electrons. Is there in nature other comparisons to this? That we don't have to look very far than just hormones. And most people in integrative movement, a lot of them have kind of cut their teeth with hormones. But when you look at hormones, small changes here can have enormous impacts. So for example, when you look at estrogen, from estradiol to estrone, there's a small change of just a hydroxyl to carbonyl group at a certain position. Same thing with progesterone versus medroxyprogesterone acetate. Progesterone is the hormone that women make, that men make. In women, it dominates after you ovulate, before you go up to your cycle. It dominates during pregnancy. And in fact, one of its, as it falls late in pregnancy, that's one of the things that helps to precipitate delivery. But a very small change at position 21 allows it to become medroxyprogesterone acetate, which is a drug. And it has very, very different effects compared to progesterone. Very different. In fact, it's very, pro-carcinogenic, not a good drug. So small changes that elicit maximum significant alteration in function is simply a rinse and repeat pattern found throughout nature. And of course, nature's God created it that way. And so why does any of this matter? Because by looking at history and returning to history, we need to recognize where we've come from, set the truth straight, and then move forward based on that foundation. And if we want to use vitamin C in the treatment of cancer, we have to follow the science. Being in the field of holistic and integrative medicine doesn't mean one ignores the science. In fact, it's being in the science that I think pushes us more in that direction. And so why does high dosing, or why does dosing of vitamin C matter? Why does the use of sodium ascorbate over ascorbic acid matter beyond a historical debate? Because it's about achieving results. A pH neutral solution, that's 7.4, is going to improve tolerability and improve compliance at pharmacologic or high dosing of vitamin C. This dosing of vitamin C has to be high dose, it has to be delivered frequently, and it has to do so in a way that's tolerable, and we have to have compliance to achieve it. Otherwise, it's a dosing that's going to not have any effect because you can't have a patient tolerate it. So it matters because we need results, but to do that, we have to have a tolerable therapy that patients can comply with. So when you look at the fundamentals of vitamin C, I think Linus Pauling touched on it perfectly here. Although physicians, as a part of their training, are taught that the dosage of a drug that is prescribed for the patient must be very carefully determined and controlled, they simply have difficulty remembering that the same principle applies to vitamins. So again, at that great debate that I talked about between Pauling, Cameron, and the Rochester Mayo, the pharmacokinetic difference was known about vancomycin. Yet the same was not applied at the time to vitamin C. So when you look at the fundamentals of vitamin C, it's not just about the dose, and I talk a lot about high dosing, and that's critical when it relates to cancer, because intuitively a 5'2", 115-pound patient sitting next to a 6'6", 360-pound patient, they recognize that their dosing is going to probably be different. And if one's a lady and one's a man, they too recognize that their cancers are probably different. And then we have to include in weight. We have to include in tumor burden, how much tumor's there. We have to include in the level of inflammation. All of these play a role, and they necessitate why we must measure plasma ascorbic acid levels to ensure we're achieving a therapeutic level. So it's not just about dose, it's also about duration and the frequency of that dose to optimize bioavailability. And of course, with IV, it's 100% bioavailable. So you completely bypass the limitations of the gut. And it incorporates the pharmacodynamics and pharmacokinetics in ensuring that we're getting delivery of the therapeutic effect to the intended target, and then the waste is eliminated. These are the simple fundamentals of vitamin C, and this is what we follow. These are what I teach. These are what we use for our patients here at Brio-Medical, and I'll talk more about this at Florida in the Vitamin C International Consortium Institute in September. So the fundamentals are about bioavailability. It's about dosing, it's about duration, it's about frequency. So if you're getting vitamin C 1 day a week, 50 grams, you are not going to be achieving a therapeutic dose that can really have a significant long-lasting impact on vitamin C. There's actually research that shows that the vitamin C in the blood and healthy liver is pretty much gone in 2 hours, maximum 16, gone, just gone. But in cancer cells, because of the higher affinity, because of a wide variety of effects, significant elevation of vitamin C levels in tumor exists for out to 48 hours. So we're talking 2 to 16 hours in healthy cells versus 48 hours in cancer cells. Very different environments, very different long-lasting effects. And that's why dosing with vitamin C really, at a bare minimum, I think is 3 times a week. The dosing, duration, frequency, and bioavailability, really, it's not just about delivering a natural therapy. We all want things that heal to heal. This concept of destroy to heal, that doesn't exist in nature. Where does the process say, well, we're going to destroy this body, we're going to destroy this animal so that we can renew a new one? We must heal what's there. So in that concept, we must deliver a therapeutic level of vitamin C to the intended target. And what we need to achieve is oxidative stress in the tumor and the tumor microenvironment. A pro-oxidative effect, not an antioxidative, but a pro-oxidative effect. Now, you can give oral vitamin C and IV vitamin C at the same time. There was a study in the Townsend Journal that showed how these work together. But to induce the pro-oxidative oxidative stress overload that we're looking for in cancer, it can't be done if it's not IV. Because we don't want to just achieve a plasma ascorbic acid level of the targeted range of roughly 350 to 450 milligrams per deciliter. We want to achieve and deliver it to the tumor microenvironment and to the tumor. And this is a problem because cancer is growing so fast, it outgrows its blood supply. And it starts to grow all these erratic blood vessels called, it's called angiogenesis or neogenesis. And this creates not only problems for the delivery of vitamin C, but simply the delivery of oxygen. So if we don't have oxygen in that environment, vitamin C can't really elicit its effect, but it also helps to remove waste. So we have to be able to deliver it to the tumor, and we have to be able to saturate the tumor microenvironment and the entire tumor. Here, not just what are called normoxic or normal oxygen area, but also the hypoxic areas of the tumor. And there's actually been animal studies that show that the high dose IV vitamin C can actually achieve a plasma ascorbic acid level that then achieves it in the extracellular fluid, achieves it with the double oxidized metabolite dehydroascorbate, that achieves it with hydrogen peroxide, and then pushing it through the tumor microenvironment into the tumor as a whole and saturating it and leaving it saturated. That's why this matters. That is where you get the effects that we need. And that's why you see a lot of studies that may not achieve results. They're just simply not dosing it right. If you have a blood pressure of 180 over 120, which I've had before because of the pheochromocytoma that I had that I've talked about at times, if I had just simply taken a low dose blood pressure to keep myself from stroking, a low dose, and not adjusted the dose up to ensure that it was achieving results, I'd say these don't work. Well, I just didn't dose it right. It's kind of what Linus Pauling talked about. We have to recognize the same science that applies to conventional pharmaceuticals or drugs and apply that to natural therapies. And that's what we do here at Brio. So what's the right dose? Well, sometimes it could be low dose. You can treat viruses with oral vitamin C. That would be considered low dose. High dose is going to be required for massive inflammation, for the treatment of sepsis, for the treatment of critical illnesses like burn patients, for the treatment of cancer. And these are really the pharmacological therapeutic doses that are required. So what's the right dose? It's the dose that elicits the intended effect we're after. And that's the right dose. But we must follow the science to achieve that. So I want to talk now, that's just kind of a review. And some of those slides were from, again, a talk I gave in Denver in September. And I'll also be repeating with some new data in September. That's going to be in June in Denver, but September being Clearwater Beach, Florida. But now I want to talk about combining vitamin C with other therapies. What I call vitamin C stacking. Not vitamin C mixing, but vitamin C stacking. So we want to combine these vitamin C with these therapies. When you look at cancer, cancer is not the result of a magic bullet. It's not just one error, one problem that has occurred. It's about many different effects, genetic alterations, metabolic effects, immune effects that are coming together. There is no one way that you can come in with a magic bullet and treat that because it was not caused by a magic bullet. You must take a multi-pronged, you must take a customized approach, a precision cancer care approach based on the field of omics and the study of omics to really stack these therapies together to elicit the healing effect that can only be achieved through the complex combination of what's called stacking. So, fasting, diet. Start off simple, right? What we eat. It's really interesting that so much in medicine disregards the impact of what we put in our mouth has on the body. But when you look at what we eat, it is the foundation for disease. And by the way, understand, Dis-ease are the two words that come together and literally means the lack of wellness. So disease means, hey, you're not well. That's all it means. It's not a diagnostic code. It is simply your body's not functioning well, it's not well. But fasting is a powerful therapy. And here we're talking about water fasting. Vitamin C, when coupled with vitamin C, combination treatment or stacking is very, very powerful. It is about precision cancer care. So here's just a brief article that looked at the synergistic or mutual beneficial effect of fasting, a diet that mimicked fasting, and combining that with vitamin C in KRAS mutated cancers. Now, KRAS is a common genetic mutation found in a large number of cancers, but in colorectal cancer, it's much more common. And here it's saying, hey, you combine simply fasting with high-dose vitamin C in colorectal cancers that are KRAS mutated, you can actually have a specific targeted effect. They're synergistic together. It's precision cancer care. It's actually understanding the mutations of the cancer, but using healing therapies to turn that around. So what happens when you combine fasting with vitamin C? You increase the cytotoxic or direct cancer killing effect. These two together will augment chemotherapy. Now, the studies were looking at full dose chemotherapy, but I would tell you it's also with low dose. What we do here is IPT. It augments radiation. The literature is really becoming too strong for people to run away from vitamin C when dosed pro-oxidatively in conjunction with chemotherapy, in conjunction with radiation. So simply fasting and high-dose vitamin C has direct anti-cancer effects and augments other therapies itself. It is precision cancer care. Vitamin C and hyperthermia. Hyperthermia is really a controlled mechanism to mimic a fever. Dr. William Coley, really the father of modern day immunology, was a surgeon back in the 19th century, and he actually treated sarcomas and other terminal cancers with what's called a Coley's toxin, which was 2 heat-killed bacteria and induced fevers, and in many patients it cured them. But it had a lot of side effects, and it was really in many ways uncontrollable. But hyperthermia, here we're talking about whole body hyperthermia or full body. Here at Brio, we devise a strategy that allows us to mechanically control it and kill the cancer cells, which is what the heat does, but it doesn't do that to the healthy cells. It stimulates the immune system to, again, immunotherapeutically go after the cancer, and then it augments other therapies. So when we stack together or combine together the treatment of vitamin C and hyperthermia, studies have actually shown that we're going to achieve higher plasma vitamin C levels. And this is going to allow us to increase the delivery of vitamin C, saturate the tissue, and increase cytotoxicity. Of course, what we do is, it's an in-clinic procedure, it's a very safe procedure, but it is an incredible procedure. And I would tell you that as it relates to the treatment of cancer for bone metastasis, or cancer that is spread to bone, there's really not a better therapy. But it's a therapy that taps into the design of the immune system to protect the body against all enemies, both foreign and domestic. And here was a study that looked at the safety of pharmacokinetics and high-dosing vitamin C with a form of a modulated electrohyperthermia. This was in Asian individuals with non-small cell lung cancer. And what they found is that you had a higher plasma ascorbic acid concentration in those who were receiving the hyperthermia along with the vitamin C. And this was improving the effects of the therapy as it relates to the treatment of this non-small cell cancer. So these two in sequence, in stacking, were really augmenting each other. Both of them can work in the cancer cells and the environment and have an anti-cancer effect, yet research has shown both vitamin C and hyperthermia can actually not negatively impact or not destroy healthy cells. I mean, novel concept. Combine therapies together that augment each other, that don't destroy healthy cells, but yet destroy cancer. That is healing to heal, not destruction to heal. One of my favorite therapies here is Artesunate or Artemisinin. And 2015, a research group out of China won the Nobel Prize in Medicine for looking at artesunate in the treatment of malaria. It's the gold standard. But what's great about artesunate IV or artemisinin, which can be IV or orally, it has incredible anti-cancer properties. It comes from sweet wormwood. This is a plant that grows readily in certain areas of the world, Madagascar, just parts of Africa, parts of Asia, very temperate tropical areas, that they grow this everywhere. I mean, in the country of Madagascar, it grows everywhere. It's like a weed. And they utilize it and provide it to the rest of the world to be used as a valuable treatment of malaria, but here it has incredible value in the treatment of cancer. Now, it's most useful when used in conjunction with vitamin C. Remember that old saying back in elementary English, what is it, A before E, except, I don't know, I didn't do well in English at that time. Here it's A before C, which is artemisinin or artesunate before C. We want to always give these in sequence and in combination, but in the right approach. This has been shown to be the effect in prostate cancer, breast cancer, liver cancer, leukemia, and even oral cancers. It possesses potent immunomodulatory and anti-inflammatory effects, each individually, but also in conjunction and in combination or in stacking. And so what kind of effects do we see? From just artemisinin and artesunate alone, and you'll remember a very similar list as it relates to vitamin C. It's anti-proliferative, which is anti-growth. It's pro-apoptotic, triggers programmed cell death. It's anti-angiogenic. It's anti-metastatic. It modulates the immune system. It has epigenetic effects. It sensitizes the cancer to radiation and to chemo. It reverses multi-drug resistance. And the great thing about artesunate and artemisinin, it's safe in children and lactation and pregnancy. So they've even used it to treat, for example, brain malaria in children with IV. So it's a very safe therapy, and together in combination, it's a very effective therapy. Stacking. And this is just a slide from a study, or excuse me, from a review article, just showing you the broad anti-cancer effects of artesunate. And it is also a pro-oxidative, just like vitamin C. And I think slides like this are important because I think so many that are unaware of the integrative movement or functional movement, a lot of conventional doctors, they look at, I think, natural, holistic, or alternative medicine as just simply throwing a dart on the wall and hoping it sticks and we hit the mark. But in actuality, we're using this in precision cancer care. We're looking at the underlying omics, all the functions, and we're honing in on specific targets that hurt the cancer cell, destroy the cancer cell, yet promote and heal the body. And so using these holistic natural therapies in combination and integration is precision-based and highly effective. Vitamin C and K3, this is another combination of treatments or stacking, looking at breast cancer, stomach cancer, lung cancer, wide variety of cancer types. You have to have it in a certain ratio, vitamin C to K3, 100 to 1. It does inhibit cancer growth. It increases the lifespan by almost 50%. It potentiates chemotherapy. That seems to be a repetitive theme you see through these therapies. It increases the lifespan by almost 60%, increases chemosensitization, and potentiates radiation. So these natural, holistic, integrative therapies themselves integrate to heal the body and target the tumor, but they also help more conventional type therapies work better as well. Hyperbaric oxygen and vitamin C, another form of stacking. So here we're looking at a study, an in vitro study, so I'll give you that. It's not an in vivo, it's not a study in humans, but it's an in vitro study looking at the anti-cancer effects of ascorbic acid and hyperbaric oxygen therapy. Just as I talked about IV vitamin C orally, so by mouth being antioxidative, IV it's pro-oxidative, and that's what we need to have an anti-cancer effect. Hyperbaric oxygen is pro-oxidative. It is pro-oxidative. So combining, in this study, they were looking at in vitro pro-oxidative hyperbaric oxygen with vitamin C. They had augmented pro-oxidative cancer-killing effects. Beyond that, hyperbaric oxygen pushes in more oxygen under pressure. So just as I told you, we need that vitamin C to get into the tumor microenvironment and the tumor, we need oxygen there too. Without oxygen, vitamin C won't have its effect. But together, not only will they be pro-oxidative, together they'll actually destroy the cancer cells. So these have to be brought together in sequence to elicit the cancer effect we all want. So here we're looking at the effects of hyperbaric oxygen and vitamin C and vitamin E. What's interesting about this, they gave 500 milligrams vitamin C by mouth, and then they treated healthy patients with hyperbaric oxygen. What they found is that the oral vitamin C didn't counter the pro-oxidative effects of the hyperbaric oxygen, and they measured this through some simple blood tests that you can do in any clinic. But they didn't dose it enough to counter that effect. So in effect, what we saw here with this study in these healthy men is that the hyperbaric oxidative therapy was actually eliciting a pro-oxidative effect that the oral vitamin C of 500 milligrams could not counter antioxidatively. So in essence, confirming that hyperbaric oxygen is a pro-oxidative therapy, which is confirming what we see here in this in vitro study that I mentioned just a second ago, that the two are pro-oxidative. And if you remember when I was talking through the history just recently of vitamin C and its pro-oxidative effects, that's what we need to do to destroy cancer, pro-oxidatively. And hyperbaric oxygen helps us to do just that. Vitamin C and mistletoe. Another stacking form. Now, mistletoe is not just for Christmas and to steal a kiss. Here we're talking about actually a plant parasite, a plant that grows as a parasite on a tree. And actually about 100 years ago, there was a physician that was actually looking at that, observing it, said, that seems a lot like cancer. There's a parasite on an organism that is the host. And he took that, and that became kind of some of the underlying philosophies for anthroposophic medicine. So mistletoe was really born out of just simply observation. But it's not about just Christmas. What we're talking about here is using mistletoe in conjunction with vitamin C to elicit an anti-cancer effect, a healing effect, heal to heal. Now, you may have heard of mistletoe. A lot of you may be on it. In Europe, it's a very common component of any conventional oncological treatment strategy. But here I'm talking about vitamin C and mistletoe actually having a huge impact on anti-cancer effects. Here was a 2004 study looking at the British Journal of Cancer. It's a phase 2 study looking at effects, not just safety, but efficacy, combining a form of mistletoe called Viscum fraxini, a very powerful form of mistletoe that is regularly used to induce fevers, combining that with vitamins, combining that to basically go after hepatocellular cancer. And what you're going to see here with mistletoe is a lot of the same effects you see exactly with vitamin C. Cytotoxic, increases natural killer cell activity, increases interferon gamma, increases tumor necrosis factor, T cell activity, macrophage activity. Again, not speculation, the specifics of what it's doing. These are the same effects that vitamin C does. So what do? We bring these in combination, we bring these in sequence, we bring these in unison, and we stack them to not just stimulate the immune system, but also to directly attack the cancer cells and not harm the body. Here was one looking at ascorbic acid and the same Viscum fraxini, improving the progression-free survival in non-small cell lung cancer. Again, its effects. Its effects of mistletoe are similar to vitamin C. Here we're looking at the combination effect improving the patient-free survival. Now this was the case study. Interestingly, case study here, non-small cell lung cancer, this patient actually had progression of the tumor on chemo after radiation. He stopped. Then he started vitamin C, 75 grams, twice a week, combining it with sub-Q mistletoe here. Now I prefer IV, but sub-Q mistletoe. And then what did they see? Well, 50% regression after a year. So natural therapies have evidence that natural therapies in combination are effective. They're evidence-based, they're effective, and they're healing. They can be used alone, or they can be used in combination with conventional medicine. Vitamin C and dichloroacetate, or DCA. DCA is a very metabolic effect that really targets specific metabolic changes that cancer undergoes. You've probably heard of the Warburg effect. This is where cancer misuses glucose. Where it should use it in one way, it uses it in another. It's called aerobic glycolysis. And DCA very specifically interferes with the cancer metabolism. And again, you'll look at DCA and the list of the effects, and you'll see a lot of the same effects of vitamin C. It targets the metabolism of cancer, the oncogenic metabolic shift. We know that through the process where cancer makes a lot of lactate instead of making energy. That lactate's pumped outside of the cell, which helps to form an acid barrier, which protects it against the immune system, but also can be used by the cancer itself. But DCA inhibits pyruvate dehydrogenase kinase. And if you watched my podcast with Dr. McCullough, I mentioned that then too, but about vitamin C. This allows pyruvate dehydrogenase to increase and force glucose down a pathway cancer doesn't like, overwhelm it with oxidative stress, create a detoxification crisis, deplete it of NAD, deplete it of ATP, and it dies. Yet that doesn't happen in cancer. So vitamin C and DCA are doing a lot of the same things. It increases oxidative stress, as I mentioned. It decreases the acidity of the tumor microenvironment, which is important because this acidity, this lactate, can actually be used by cancer cells. It augments chemotherapy. That sounds just like vitamin C. It's synergistic with repurposed medications. Well, vitamin C with doxycycline is great against bone cancer, but it's also great against cancer stem cells. DCA is great with metformin. DCA is great with Celebrex. It increases sensitivity of tumor cells to radiation, and it modulates the immune system. That's the name of the study that, or the review article, Dichloroacetate and Cancer, an Overview Towards Clinical Applications. Now this is looking at vitamin C, DCA, as it relates to lactate, because a lot of the thought is that lactate is pumped outside of the cell because of this Warburg effect, and that's where the story ends. But in actuality, cancer can use lactic acid. It can use lactic acid to promote its own survival, its own energy production. And that's what's called tumor lactate-based metabolic symbiosis. So the complexity of this process grows. And I actually had a patient one time that said, well, Dr. Goodyear, isn't brevity the soul of wit? I said, well, yeah, because he was referencing to being, complex in describing the mechanisms of the biochemistry and the physiology changes that cancer undergoes. And I told him, I said, we're not trying to be witty, we're trying to be effective. And we need to understand all of this complexity to be effective, to target the tumor so that we can heal the body, but not destroy it in the process. Same process there. It does the same thing as vitamin C in terms of its overall cancer effects, but it's doing it differently. That's why they stack together in wonderful treatments. So I'm going to be speaking at a conference in September where I'm going to really be talking deep into some of the pharmacokinetics as it relates to cancer, even more so than we talk about here. This is open to both doctors and to patients. We have a great, you can see our mission statement, commitment, and vision. We really want to push forward the envelope of precision-based cancer care using high-dose vitamin C as guided by the science. Have a great lineup of expert speakers, Dr. Richard Fleming, Paul Merrick, Pierre Corey, Dr. Joseph McCullough, of course myself, the CEO of VCICI, Lior Scher, incredible lineup of veterinarian oncologists. They're doing some great things. Dentistry, doing great things with vitamin C. And of course, if, the best answer to cancer is never get it, preventative. But if cancer occurs, we're here, Brio-Medical, Holistic Integrative Cancer Healing Center, we're here to really focus on you as an individual, provide that precision cancer care approach, one that promotes healing, not destruction, so as to promote healing overall. Target the tumor, heal the body. That's our goal. Dive into hope, healing, teaching, and make the body renew itself. That's what we do here. So a little technical, a little long, but just wanted to take an opportunity to review that, but then add some new concepts to it, the concept of stacking different therapies together. So I hope that's been helpful. Now what we want to do is kind of open it up for Q&A for any questions that you may have. How safe is high-dose vitamin C with patients who have below normal G6PD? Good question. G6PD, also known as glucose 6-phosphate dehydrogenase, is an enzyme that, when deficient, if you give high-dose vitamin C, you can actually get a significant hemolytic effect where red blood cells are destroyed. And it could be a dangerous thing. It's very rare, but in those that have G6PD deficiency, it is something that does limit the use of high-dose vitamin C in the higher doses. In my clinical experience since 2006, I've only seen 2 patients with it. Now, in cancer, it's important to understand, because of all the metabolic changes that cancer undergo, you will actually typically see an increase in glucose 6-phosphate dehydrogenase as a part of the metabolic changes that cancer does. So it can actually be used as a biomarker for cancer. So in G6PD deficient patients, yes, it would limit the use of high-dose vitamin C, absolutely. But recognize it has significant monitoring effects in the treatment of cancer. We had a patient here now who she came in with her G6PD non-detectable. It was so high. Now she's 4 weeks into treatment and her vitamin C is actually now in the normal range, coming down. What does that tell me? Metabolically, we're hindering the cancer. We're winning. Can this cure metastatic bladder cancer with a 5% cure rate? For 60,000 feet, this is for sure healing method. Okay, I think first the word cure, that's not a clinically validated endpoint. It's what we want to be is we want to be evidence-based, but we want to be healing, holistic, natural. The word cure is a word that's put out there. I just read a journal article this morning, mentioned the word cure. Clinical endpoints are what we use in studies to help us determine, was this effective or not? And cure is not one of those. It's never been evaluated as a validated clinical endpoint. Healing, that's something that I think is more tangible because that's what the body does. So I think to be evidence-based, cure, I mean, it's a little esoteric, but I don't think we should use that term. But metastatic bladder cancer with a 5% cure rate, what I've learned over the years, many of the patients we see are 1, 2, 3 times recurrent cancer. They failed conventional therapies, maybe 6 months, a year, chemo, radiation, multiple surgeries, and they're discharged to hospice. They told them there's no options other than experimental studies, and they come to us and we undergo treatment, and lo and behold, they get better. I mean, one such patient was recurrent breast cancer. Oncologist told her nothing she could do. She had liver, lung, bone mets, and now she's approaching 2 years, and she has a small little area in the lung, small little area in the bone that we're working to eradicate. Another lady with breast cancer, bilateral breast cancer, is told that she is going to lose both breasts, and she now has both breasts over 2 years, and she has no evidence of disease. So, looking at cancer from a stage 4 advanced nature, we've seen a lot of patients that are told there's no hope. Look at those percentages. You're talking about a 5% cure rate. We see a lot of those patients overachieve. A lot of those patients achieve something that they didn't know that they could achieve. They may not be fully healed, but they're on the pathway there. Now, cancer is cancer, so sometimes it's just tough. But what I've seen is, my job as a physician is not to tell people and predict their outcome. I've seen too many individuals that are told their body cannot achieve an outcome that's positive, and they do. So what that's told me is my job as a physician, Raphael in Hebrew, it's to heal. Not to take people that are stage 4 and say they can't be healed, but to try to heal them. And so what we've seen is patients achieve the impossible. So it becomes possible for them. Bladder cancer, stage 4. Breast cancer, stage 4. Colorectal cancer, stage 4. Gastric cancer, stage 4. Non-Hodgkin's lymphoma, prostate cancer, you name it. We've seen these results in these patients. We don't predict the outcome. We work to achieve the impossible and see what the body does. Do you treat something, an Epstein-Barr virus, which is a herpes virus? Not sure what that is. Well, when you look at the treatment of Epstein-Barr virus, which is the treatment of mono, or herpes is different than Epstein-Barr, but vitamin C is very effective against both of those. So we don't just, here at Brio, we don't just treat Epstein-Barr, we don't just treat herpes, but understand that certain cancer types, 15% of all cancer types come from viruses. So Epstein-Barr virus can be involved in Burkitt's lymphoma, herpes virus, cervical cancer, and other varieties. So we do see people with cancer types that we treat that have those viral issues. Oh, here's a good question. Your thoughts about high-dose vitamin C while taking NAC or glutathione? No, you don't do it. I kind of referenced that, and it's not in this study in particular, but it's in the talk I'll give down in Florida, that one of the effects of vitamin C pro-oxidatively in cancer cells is it depletes the cancer cell of reduced glutathione. And this is important because it creates a detoxification crisis in the cancer cell. So NAC is the precursor to glutathione. So if we're giving glutathione, if we're giving NAC to a patient with cancer, cancer can use that. We don't want to counter, we don't want to stub our toe. We don't want an unforced error here. We want to take the advantage that vitamin C gives us, which is eliminate the ability of the cancer cell to detoxify the pro-oxidative effect, but that doesn't happen in the cancer cell. No, so these two together, it's my opinion that it's contraindicated, and I would not do that. If I come to Brio-Medical Cancer for therapy, how long is the typical stay? Good question. When you look at the majority of our cancer patients, most of them come in with advanced stage. And so in that, I tell them our goal for you when you come in and when you leave is to leave with no evidence of disease. That's my goal. Help you achieve the impossible, so make it possible. And what I've seen is that 6 weeks is the minimum of what it takes to change the metabolism of the cancer, to destroy the cancer in a way that allows us to see no evidence of it from laboratory, clinical, exam, or imaging. So 6 weeks is our program. I know there are those out there that have 3 or 4 weeks. My clinical experience has been that you cannot achieve results that you're after in that time frame. Cancer is a complex, massive process. We have to understand it. So if we're going after that no evidence of disease goal, that big goal, achieve the impossible, make it possible, 6 weeks is what it takes. So those two situations where I mentioned 2 women with breast cancer, seen in prostate cancer, got a gentleman now doing really well, a gentleman with Merkel cell carcinoma that recurred after going to 2 premier integrative hospitals in the country, and he's now working in a new career, and he's cancer free, and he was with us for 8 weeks. So he'd recurred twice. He's 8 weeks now. He's now approaching 1.5 years, but he was 8 weeks and he's healed. Cured, not a medical term, but he's healed and he's back working. So 6 weeks, that's what our time looks like. How many weeks do you receive IV vitamin C for cancer treatment? Not everybody receives vitamin C. Again, we try to be precision and cancer based. We have a patient here with breast cancer, and I keep mentioning breast cancer because it's one of the top top cancers for women and top cancers in the world. She doesn't get vitamin C because her genetic testing told us curcumin and quercetin is what she needs. So that's what she gets, because her results showed that the cancer is using something, or genetically has altered itself, so that curcumin and quercetin are the best result, not vitamin C. So not everybody receives vitamin C, but many do. Some patients will get it 5 days a week. So for example, we have a gentleman here with colorectal cancer with a KRAS positive mutation, which tells us vitamin C, and more vitamin C. So he's going to get vitamin C 5 days a week. Some patients will get it 3 days a week. Some patients won't get it. And then the dose is going to vary for every individual. Do you use ivermectin with vitamin C? Oh, good question, Brad. Absolutely. Absolutely. Ivermectin has a lot of anti-cancer properties, and it has a lot of antiviral properties too. And that's been known before 2019, a long time, many decades. And ivermectin falls into the category of repurposed medications. Now, ivermectin alone, is it going to, heal the body from cancer? No. Can it help? Absolutely. Combine it with other repurposed medication, other holistic and integrative cancer therapies, it becomes a very powerful tool. And through the entire COVID pandemic, the height of it, I had one patient test positive for COVID. One. And it was because we were putting all of them on ivermectin, vitamin C, and some other therapies that really boosted their immune system. Again, immunotherapy, not to target it like chemotherapy, but to stimulate the immune system to do its job. And the immune system's job is to protect the body against all enemies, both foreign and domestic. So no surprise that the therapies we were using for the cancer were therapies that were stimulating the immune system against the cancer. We're doing the same against any virus, and in that case, the SARS-CoV-2 virus. Can you work with cancer patients that are on heart meds after heart attack with a pacemaker? FYI, I'm doing great now in that regard. Yeah. I mean, we have a gentleman right now with prostate cancer. He's doing fantastic. His PSA is down to 1.2. He's doing great. We've discharged him from the practice. He's had four pacemakers, I think. Yeah, I think that's right. And he's doing great. So absolutely, we can work with it. Now, there are some limitations. So, some pacemakers may not be compatible with hyperthermia, but those would be very old. The Xarelto, the lisinopril, the Lopressors. Yeah, I mean, almost every patient we see with cancer, they have many different comorbidities. Hypertension, we have a lady here with endometrial carcinoma, cancer of the uterus, and she has hypertension. And we changed up our medications. One medication to a more anti-cancer hypertension medication, but one that has more anti-cancer effects. Some medications that you may be on may not be helping the cancer fight, and so we can actually change some of these medications that will help your blood pressure, but at the same time augment what we're trying to do to heal the body from cancer. So absolutely, great that you're doing well, but absolutely we see patients in your condition. Have you ever treated nasopharyngeal cancer stage 4? What are the outcomes? Yes, we have a patient here right now. Oh gosh, we have several patients here right now. And over the years, esophageal, tonsillar, tongue, head, variety of head and necks, squamous cell. We have a lady here right now. I've seen her now for, since the first of the year, but she is doing incredibly well. She has maxillary squamous cell carcinoma, came with a big mass in her neck. She couldn't eat, so feeding tube, lots of pain, and now she still has the feeding tube in place, but she's eating, she's smiling, she's laughing. And in fact, her husband got COVID, and she did too. He's still struggling, and she's doing great. And her tumor, I just examined her this week. It's almost not even palpable. So we're going to repeat a scan and kind of see where that is, because it's just not there, and she's not in any pain, and she's eating and doing well. And before, she couldn't even put water. She couldn't even drink water on that side. She couldn't, let alone chew on that side. I mean, just swollen, painful. So do we have good results there? Absolutely. I've seen people come in that they couldn't open their mouth, and then we get it to where they can open their mouth some in a short time frame. Now, those patients, obviously, there's major problems, and we have to continue treatment at home, but we've had good results here. Leukemia and lymphomas, a question about different types of leukemias and lymphomas. Absolutely. Really good results with non-Hodgkin's lymphomas, a variety of types, large B cells, also Hodgkin's. One of the most sickest patients I've ever seen came in with Hodgkin's lymphoma. Ended up spending a month in the ICU because of renal failure, because of the degree of his Hodgkin's lymphoma. And not only did he get put on dialysis, but You know, he was in ICU, and now he's cancer free for years, and he's got taken off of dialysis. So he's traveling with his wife in their motorhome. He's a cheesehead. That is, Green Bay Packers. Thank you, you bet. Trying to see why this won't let me scroll up. Okay, well, it looks like my screen froze up. And so I can't scroll through the questions. All right, sorry about that. Well, I can see there's more questions there, and I apologize I can't get to them. My pop-up screen for the Zoom to scroll down through these messages has frozen up. So I appreciate everybody's attendance. Hope it's been helpful. Again, this will repost on our YouTube channel for Brio. Check out our website, more information there. And if you happen to be in the Clearwater Beach area, go to the vciciwebsite.org and you'll find out about the conference there. But go to Brio-Medical, and there you'll find out and hear some of the other people's stories and find out more about the science of what we do here at Brio-Medical about healing the body on the way to healing. No destruction, but healing the body on the way to healing. Thanks for attending, and have a great night.